Nigeria Center for Disease Control records 501 COVID-19 infections as state governors order work from home directive. Socioeconomic Rights and Accountability Project (SARA) asked President Buhari to suspend two-week deadline for national identification number registration. In international news, as public skepticism greets Germany's acquisition of COVID-19 vaccine, Israel kicked off its coronavirus vaccination campaign. And in sports, Ghana win WAFU B Under-20 championship.
This is ANN News.
I am Olajumoke Olatuji. Nigeria's COVID-19 cases continue to surge as the Center for Disease Control recorded 501 new infections on Sunday. The new figures have now increased to the country's total coronavirus infections to 78,434. Lagos continues to lead the pack with an additional 218 infections. FCT had 112. Kaduna reported 53, while Plateau and Katsina respectively confirmed 24 and 21 infections. 10 states shared the rest of the numbers. NCDC says more than 800,000 samples have been tested so far out of Nigeria's 200 million citizens. 3 deaths were also recorded, bringing the total number of casualties to 1,221. And state governors, including those of Lagos, Anambra, Ogun, and Kaduna, have started reinforcing COVID-19 protocol enforcement as new ways of avoiding a second wave of the virus. Governors say the enforcement of COVID-19 preventive measures, such as wearing a face mask, social distancing, and hand washing, are now very important. Many Nigerians have abandoned those safety precautions at a time when there is a spike in the virus around the world. Lagos State Commissioner for Information Benga Omotosho says the state does not plan to shut down the economy. Lagos and Kaduna civil servants from level 14 downwards have been instructed to work remotely starting today. Last week, the Lagos State government vowed to impose hefty fines on COVID-19 protocols violators. Mosque and church services hours have also been curtailed to help curb the coronavirus spread. And while Imo State Governor Hope Uzodinma has ordered the closure of the state secretaries effective today, the governor has ordered the arrest and prosecution of all violators. He also limited to not more than 100 the number of persons in social gatherings in the state during this Christmas season. Health Minister Osage Ehanire says Nigeria should receive its first doses of COVID-19 vaccine in January. Ehanire says Nigeria has a working group in place to handle vaccines and is collaborating with the COVAX program backed by the World Health Organization. Correspondent Dedi Badmos has the story.
With the rest of the world scrambling to get the COVID-19 vaccine, Nigeria does not want to be left behind. The government expects to get its first batch of vaccines before the end of next month. But the health minister warns that the logistics of procuring and storing the vaccines will be quite challenging.
There are 2 types of vaccines, as you have heard. There are those that have to be in ultra deep freezers, the mRNA type of vaccine, freezers that must give you at least minus 80 degrees. There's another type that can be a deep freezer of minus 20, and there's another type that can be in a refrigerator of 2 degrees, which is a regular refrigerator. Now, the one that's a regular refrigerator is easy in that you can just put in where many of such regular refrigerators all over our country. Minus 20 will also be possible because we have freezers, what we call freezers. But the ultra cold freezers, we hardly have any in our country. Therefore, to receive and store those ultra cold vaccines will require that we go and purchase and procure those ultra deep freezers.
Some experts say the target of getting the vaccine to Nigeria by January might be too ambitious, given that there's still not enough at the moment to go round. But the government says it has signed up with the WHO and Vaccine Alliance Gavi to access the jab.
We're also having bilateral discussions, talking with manufacturers. Some of them have written to us, want to have talks with us, and I think one of them was, as I speak to you, is already having a discussion in the Ministry of Health. The ones that the British and the Russian teams are teaming up to put together, we're working with them, because if we cannot get enough from one source, we should be able to get from other sources.
But for many health experts here, getting the logistics right is what worries them most. The vaccines are expected at a time when there have been some conspiracy theories circulating about their efficacy, even here in Nigeria. So as the authorities prepare to receive the vaccines, they'll also have to strongly campaign against the conspiracy theories, which could take religious and cultural dimensions here.
The Socioeconomic Rights and Accountability Project, SERAP, has urged President Muhammadu Buhari to suspend the 2-week national identity number registration deadline and withdraw the threat to block SIM cards. SERAP says it is unnecessary because the bank verification number, BVN, a driver's license, international passport and voter's card can be used to harmonize and integrate existing identification databases in government agencies into the National Identity Database and to use the information to update SIM card registration. The federal government has threatened to block all SIM cards not linked to NIN by the end of the month. Meanwhile, workers under the umbrella of Private Telecommunications and Communications Senior Staff Association of Nigeria have also rejected the 2-week deadline given to telecommunications operators to block subscribers' lines if they fail to link them with a national identification number. Akwa Ibom State Governor Udom Emmanuel has asked for an investigation into the alleged case of child abuse of a secondary school boy at the Deeper Life School in the state. A video emerged over the weekend of a mother questioning the health and physical looks of a son who just returned from the boarding school. The governor has directed the Commissioner for Education to immediately investigate these complaints and take necessary action. Coming up, African stories. The Democratic Republic of the Congo imposes countrywide COVID-19 curfew as cases spike in the country. And later, international news. As public skepticism greets Germany's acquisition of COVID-19 vaccine, Israel kicked off its coronavirus vaccination campaign.
You are watching ANN.
The city slept. We installed a board in the middle of a park with something special hidden inside. We wondered if people would notice. They didn't, so we invited Nigerians to add their polls to the scene, whichever way they chose to. Some literally added their own polls. Some sang, others rapped, and even recited poetry. As they added their polls, the board came alive. Hidden figures broke free from obscurity, inspired by the crowd expressing themselves.
You know you can't do anything.
Because why blend in when you can stand out? NTN polls. Do you? Dial *406# to join.
Welcome back. This is ANN News. Coronavirus new wave is being felt in many countries, including several African nations. The Democratic Republic of the Congo is experiencing a rise in COVID-19 cases that it has imposed a nationwide curfew to slow the spread. Correspondent Chris Okamringa has the story.
The DRC has recorded a spike in COVID-19 cases over the past 2 months. The Health Ministry has consequently imposed a curfew to stop the spread of the disease. Entrepreneurs like Mifi Makabu, who runs this bar and restaurant in Kinshasa, fear the move may push them out of business.
Many of our customers start coming here at around 9 p.m. That curfew will really affect my business. The government should reconsider it because many of us will be forced to close our businesses.
The government has also banned meetings of more than 10 people and ordered the compulsory wearing of masks in public.
Many people living along this road that leads to Kinshasa's airport will find it difficult to beat the curfew at 9 p.m. This area has one of the worst traffic jams in the whole city.
Many residents of Kinshasa have criticized the new measures.
My biggest worry about these new COVID-19 measures is how they will be enforced. Our police force is very unprofessional. Many officers will use the curfew to harass and extort money from us. The government should train them to do their job professionally.
The government should extend that curfew. I live so far from my workplace and usually return home late. I just don't know how I will manage.
The government says the number of patients with COVID-19 is higher than those recorded in the first wave of the pandemic. The Health Ministry has recorded more than 14,000 cases since March this year.
It's not only the DRC that is seeing rising COVID-19 cases. Uganda is actually said to be nearing uncontrollable number of transmissions. Health authorities in the country say the fight against the disease has somehow been lost. Uganda Broadcasting Corporation correspondent Sahara Abigawa reports.
At the time President Yoweri Museveni announced a total lockdown of the country, all appeared to be managed well with few cases, most of whom recovered, and the country began to open up. The fear of contracting the disease stood between 70 and 80% between March and May. However, with non-compliance with the set standard operating procedures, especially washing of hands and social distancing failing among many communities, hell broke loose and the infection rate shot high. The standard operating procedures have generally been dropped and one only has to venture into downtown Kampala's Kikubo Lane and Womo Street to understand why Kampala Metropolitan is long-standing the hotspot for coronavirus. We asked the presidential advisor on the pandemics, Dr. Monica, on what went wrong on the management of COVID-19 in the country.
And of course, at that time, we were busy reading and finding out what is it that we can do. But in that time, we were not communicating to the public what is happening. And so other things came and took advantage. And one of the things that took advantage is politics.
As the country experienced a near COVID-19 spike, the ministry is first with upholding an image of excellence it boasted of earlier.
The population gave up observing SOPs. Then Kampala became overwhelmed.
The senior presidential advisor on epidemics, Dr. Monica Monsenero, says that Uganda is fast moving to the stage of uncontrolled transmission, especially in Kampala.
And we really can take back our lives from COVID. But this time the roles are flipped. Because at this stage, if you expect police to chase down everybody, it won't work.
Going by the recent COVID-19 curve, Uganda is headed for difficult times. Hospital beds are filling up very fast.
For my over 10 years as a pulmonologist, I've never had such a large number of people who need oxygen. I have run a pulmonary ward for all these years, would have like 3-4 patients. But right now, you find you have a ward of 200 patients and almost 90% of them are on oxygen.
Lung Institute Dr. Bruce Kilenga says the health frontline workers are overwhelmed by the numbers of patients coming in for treatment and also because of working for long hours.
So if you are going to be in this PPE from 9 to 4 p.m., it's really a lot on us. You really become dehydrated. You sweat from head to toe several times.
This is the general public managing COVID-19 at home to adhere to the standard operating procedures.
So if you intensify measures, washing hands, but most important, putting on a mask and staying away from each other. That's what people should do when they have someone who has COVID in the home.
Uganda has registered over 28,000 COVID-19 cases and over 250 deaths. The Ministry of Health now wants Ugandans to act responsibly to survive the pandemic. Zahara Abigawa, Kampala.
Africa has now surpassed 2.5 million coronavirus cases as the second wave of infections hits the continent. Figures show more than 450,000 new COVID-19 cases have been reported on the continent in the past 1 month. South Africa remains the worst affected African country with more than 900 cases and nearly 25,000 deaths. The country has seen a sharp spike in infections since the beginning of this month. The government said on Friday it had identified a new variant of the coronavirus that is driving the second wave of infections. Countries like the Democratic Republic of the Congo, Nigeria, Mauritania, Ghana, and Ivory Coast are also seeing a sharp rise in coronavirus cases. Many countries have begun imposing lockdowns, curfews, and restrictions on gatherings ahead of Christmas celebrations. On Friday, Nigeria ordered schools to shut indefinitely. It also banned concerts, carnivals, and street parties. Some Lagos state civil servants have been ordered to work from home. When we return, international news. As public skepticism increased Germany's acquisition of COVID-19 vaccine, Israel kicked off its coronavirus vaccination campaign. And in sport, Ghana win Waffle B Under-20 championship.
You are watching ANN.
Somewhere in the world, every second of the day, news is happening. And of course, Nigeria is bustling with news day and night. That is why ANN doesn't sleep. Our eyes are peeled, wide open, so no story escapes our radar. We stay abreast of world events and happenings at home. We keep you up to the minute in the world of sports. We give you information to stay on top of your investments and all the hard facts you'll need to navigate your day. If you miss us on air, you can keep up to date on our website and on our social media platforms, Twitter, Instagram, and Facebook at ANN Africa TV. We are ANN, African News Network. We do news right in a truly African spirit.
Welcome back. This is ANN News. Germany is one of the first advanced nations to receive the COVID-19 vaccine. The nation plans to inoculate millions of its citizens against the deadly virus, but there is skepticism among the German public about the virus. Correspondent Natalie Carney reports.
According to the German Ministry of Health, Berlin has managed to secure some 136 million jabs for the country in an order comprising of both the BioNTech Pfizer and Moderna vaccines. The aim is to have the vast majority shipped here by 2021. That is, of course, if these vaccines are approved by the European Medicines Agency. The German government then plans on starting to roll out these vaccinations on December the 27th, starting first with those above the age of 80 and those that work with the elderly, followed by medical staff and intensive care units. According to the country's health minister, Jens Spahn, this phase should take upwards of 1 to 2 months, and then the program will be broadened out. But the big question is, are Germans willing to receive the jab? According to a recent study, 1 out of 2 said they will. The rest want to see a lot more research done.
No, I will not get vaccinated. You don't hear anything good about it, and such short-term vaccinations. I don't know. I don't believe in it.
Definitely, for sure. I mean, it's for like the general health, so I'll definitely be taking it.
Me personally, I will be a bit cautious, I think, and wait a few months, perhaps a year, until you see what is the outcome and what are the side effects of a vaccine.
I will. And I think it's necessary that most of the people will do it, so we will be safe.
While it won't be mandatory to be vaccinated here in Germany, experts do say that at least 2/3 of the population will need to receive it in order to achieve herd immunity.
While Germans expressed skepticism, Israel is moving ahead with its own vaccination campaign, which kicked off over the weekend. Prime Minister Benjamin Netanyahu was the first to get the jab. Correspondent Stephanie Fried reports from Tel Aviv.
Henri is suspected to be suffering from coronavirus. He lives not too far from the hospital, but he's been admitted as a precaution because he's 81 years old, and as a vulnerable person, he's being looked after while he waits for the results of his COVID-19 test. This hospital has been able to free up capacity to create special COVID-19 wards by moving non-coronavirus patients into other parts of the building. But in March, during the first wave of infections, things were very different.
The first wave came quickly and it was monstrous in terms of numbers, in terms of hospital admissions. We had people on ventilators and it was very serious. It happened so quickly and on a mass scale.
This woman has been on the COVID-19 ward for a week. She also has a neurological condition. Now she's free from the coronavirus, she's able to leave the ward and return to specialist care.
This is one of 2 specific wards in this hospital only dealing with coronavirus patients, but there are also people suffering from COVID-19 in neurology and in intensive care.
As the numbers of cases and deaths have continued to rise, one side effect has been the personal pressures on nursing staff on the front line of the fight against a new disease and a deadly pandemic.
C'est vrai que ça a été difficile. On a eu beaucoup de décès, surtout au début.
It was very hard. We had a lot of deaths, and when we go home, we have to try to sleep after dealing with all this. We were also afraid we would catch it at the start, and we didn't know if we might die if we caught it. Now we're used to it, so we're less afraid, and there's not as much fear.
This time of year is especially tough for people in the hospital who can't spend time with family and healthcare staff who have to work over the holidays. The lead nurse has made special baubles this year to recognise her colleagues' efforts. The doctors and nurses say they're ready for a third wave in the new year, but warn that despite their preparations, a surge in post-holiday cases would place renewed pressure on a hospital system that is fast approaching a whole year of dealing with the pandemic.
We'll take a break. I'll be right back with sport. Welcome back. This is ANN News. In sport, Ghana defeated Burkina Faso 2-1 to win the WAFU B Under-20 Championship Trophy in Port Novo on Sunday. Despite Ghana's victory, Burkina Faso's midfielder Botu took home all the individual awards after being named the best player of the tournament. He also added the top scorer award for scoring 3 goals in the tournament. The 2 teams will represent WAFU B at the total Under-10 AFCON in Mauritania next February. Watford have appointed Cisco Munoz as the club's new head coach after sacking Vladimir Ivic. A Spaniard joins the championship club from Georgia top-flight side Dinamo Tbilisi. 40-year-old former Valencia, Levante and Real Betis coach becomes the Hornets' 5th manager in just a year. Ivic was sacked on Saturday. Watford have not disclosed the length of Cisco's contract. And that is ANN News this evening. Thank you for joining us. For details on these and other breaking stories, visit our website, annafrica.news. Conversation continues on our social media platforms, Twitter, Instagram, and Facebook at ANN Africa TV. I am Olajumoke Olatuji. Have a pleasant evening.